We're headed into a study of the brachium, the elbow, antebrachium, wrist, and hand. And we just want to make sure that we've got a good handle on skeletal and muscular and ligamentous structures of those joints. And this video is intended to work on the muscles of the brachium, which are obviously glenohumeral effectors, and those effectors, muscular effectors of the elbow. Before we go there, let's work on remind ourselves about the anatomy of the shoulder. I think the novice thinks of the elbow being this singular joint, which is ulna and humerus. You can see posteriorly that the olecranon fits into the olecranon fossa. That really is a hinged joint. But the elbow consists of 3 joints. So this is that same bone, the proximal ulna, articulating with the trochlea. Some people call it the spool. And I'm going to show you here with the skeletal structure. Here is the ulna, olecranon process and coronoid process, articulates with the trochlea, the spool, and on extension, olecranon into olecranon fossa, and coronoid process into the coronoid fossa. 1 degree of freedom, flexion and extension. Well, you see that laterally, that's medial, that's lateral. Laterally is the capitellum, and the radial head of the antebrachium articulates with that capitellum. So flexion and extension, this movement at the elbow, is occurring around these 2 joints. Well, the 3rd joint is the articulation between the radius and the ulna. This radial head articulates with the fossa of the radius, and pronation and supination occur. Just to get your bearings, the radial head, lateral, the radius, the distal portion of the radius is really huge compared to the proximal portion, and the radial head will always be on the thumb side. So there you are in anatomic position. Your radius and ulna are parallel to each other, and then in pronation the radius wraps around the ulna. Appreciate the fact for the freedom to do that, pronation and supination. There's also a distal articulation that we'll talk about later. Well, the muscle motors, you know what, let's pause there and say the stabilizing structure of the elbow are lateral collateral ligament, medial collateral ligament complex, and the ligament that holds the radius to the ulna is the annular ligament. Now the annular ligament, if you did this and you came right here to your radial head and just to fix that, this is a wonderful stabilizing influence that allows for pronation and supination, but it keeps that radius in place. It's at this point that I want you to be able to find the radial head. So if you'll come to the widest part of your elbow, this is the lateral aspect of your humerus, this is the lateral epicondyle. If you'll move from that lateral epicondyle toward your hand, you'll feel a little canyon, and then you'll feel a bone. So go back, lateral epicondyle, joint space, radial head. Now this gets fun when you get to the radial head and you pronate and supinate, and you can feel that radial head underneath your palpation. Now since we're here, let's do this. Let's put a thumb on the medial epicondyle, the middle finger, 3rd finger, on the lateral epicondyle, and your index finger on your olecranon process. In a fixed elbow, healthy fixed elbow, that forms an isosceles triangle. In a luxation, this would be a straight line. This is what occurs in a luxation at the elbow posteriorly. Yes, and you can see that that would result in those three anatomic positions or structures being in one line. So that's the stability part of the joint. And then the muscle motor effectors of the elbow. Certainly the biceps brachii is a major flexor, and the triceps a major extensor. Okay, here's a view of them in extension. You can see the long head of the triceps affixed superiorly to the scapula, which makes the triceps a two-joint muscle, and the long head of the biceps attaches to the supraglenoid, the short head to the coracoid process. So this muscle also affects glenohumeral joint, and they're major elbow motor effectors. It's way important for you to understand where the biceps attaches. So if I laid that down there, here's your biceps approaching its distal attachment, and it attaches on that bicipital tubercle of the radius. Therefore, the biceps is a major supinator of the forearm. It's a flexor of the elbow and a major supinator. So when we're way into pronation, it's like right here it is. It's like the biceps is way wound here. There's elongation of the contractile tissues of the biceps, and so it's in a great place to supinate. So that's the attachment on the proximal radius of the biceps brachii. Well, the muscle that gets not enough attention, it is deep to the biceps brachii, is the brachialis. And it's represented on its proximal attachment by all of this red. You can imagine how really huge this muscle is. And its distal attachment is on the coronoid process, right here where this blue dot is. So right here, you get a grasp of brachialis, proximal attachment, and at the blue dot, distal attachment. So it's a major flexor, and it controls, along with the biceps brachii, the rate and extent of extension. Okay? And then, so superficial, go ahead and tighten your muscle there, isometric contraction. Now if you'll slide your fingertips, your thumb and your middle finger, laterally and deep to the biceps, you'll push down. You're pushing on the brachialis muscle belly. All right? And then if we move posteriorly, we've already talked to you about the triceps. You get that part. A muscle that you might not be quite as familiar with is the anconeus. Now at this point, what I want you to do is to push down on your desk and palpate laterally. Okay, relax. Just see that you don't have big tension there. Here's your olecranon. Here's your lateral epicondyle. And put your finger right there and push hard down, load it into extension, and you'll feel the anconeus get way firm. The anconeus obviously is a single joint muscle, and it's an extensor. It's synergistic to the triceps at the elbow. So it would be concentrically contributing to extension and be synergistic in controlling the rate and extent of flexion. And so be way familiar with the joint configuration. Don't worry about inferior to this. We're going to go there later. But that's an opportunity for you, or the purpose of the video is to review your anatomy with you. And hope that's helpful to you. Thanks for being students of the brachium and elbow. Bless you. Bye.